I'm surrounded by babies, and they're babies that I've helped to deliver. And if I was asked, would I want to come back as a female in another life, I'd probably say no, not because of the babies, but the thought of having a pap test and the pain that sometimes brings on, and all the other things that women have to go through to have a baby, and then the birth itself, and then this thing coming out through your vagina or through your tummy, and all those things really frighten me. And as a practicing gynaecologist, I was told at the very beginning of my career, if you want to keep the patients happy, don't hurt them. Be gentle when you're doing a vaginal examination or a pap test. And over the years, and I've been practicing now for 45 years, I found that sometimes women just don't like having a pap test, and it hurts. And so recently, a product came on the market that stops the pain and allays their anxiety, and I've used it constantly to help women have things like a pap test, an intrauterine device placed into the uterus for contraception, if they need to have specialised treatment in an IVF program, such as a scratch of the uterus or a biopsy of the uterus, or a transfer of some fluid into the cavity before transfer. I've used it for embryo transfers in my IVF practice. Some women have it for the insertion of Implanon, which is a contraceptive device, and the removal of such device. You can use it for biopsies down around the vagina if you've got a little skin tag or something like that and you want to take it off in your rooms. That and a bit of local anaesthetic is probably all you need, and it's better than having a general anaesthetic. This is the green whistle, or Penthrox, which is a fantastic medicine which is short-lived, and the actions are short-lived. So women come in to have, say, a pap test, they puff on this for 5 minutes, and then I can do the pap test, and they hardly know what's going on, and it is fantastic. Some patients are so frightened of having their blood collected. You can use that for that as well. So there's a whole range of things that you can do, especially if you have a fear of having, say, sutures taken out after a laparoscopy or surgery. Again, this helps. And the beauty of it, it wears off very quickly, and you can drive home. And there's more. I mean, it's not very expensive. And most doctors stock it. So it really is quite a fantastic way of avoiding pain in general gynecological practice. So for those women who are frightened of pap tests, having IUDs put in, having other contraceptive devices put in, having sutures removed, embryo transfers, endometrial scratch, embryo transfers, all these things can be managed. And what's music to my ear is so many of these young babies here, the ones that are females, are getting the message. I can sense it, that they're understanding what I'm saying. Thank you.